The seventh newborn feature is your baby could have enlarged genitals. Don't be alarmed about this. It's very, very normal. Hey there, beautiful mamas. You're all welcome back to my YouTube channel. So today's topic is a very interesting one. We're going to be talking about the 10 newborn features that you need to know about as a first-time mom, because you don't want to be taken aback and like asking yourself, what is this on my baby? Yes, there are some things that might look a bit weird and strange, but they're actually normal. First on the list is what we call fontanelles. Now, these are fascinating soft spots on your baby's head. There are two of these fontanelles, a very large one in the front around this area and another one at the back. Now, the importance of the fontanelles is that they help your baby's brain to grow, okay, because your baby is still growing, so your baby needs that space to grow, because if those fontanelles, those spaces were not there, your baby's brain would just be, compressed. And guess what? These fontanelles, they actually don't close until later on in life. An important thing you need to know about the fontanelle is that it helps tell you how hydrated your baby is. So if your baby is dehydrated, you can expect that the fontanelle would be depressed, okay? And that is a red flag. It's a danger sign, and you need to take your baby to the hospital, to the emergency, as soon as possible. If it's bulging, that's another red flag, another danger sign that something could be wrong as well. Okay, you just want it to be flat and nice, and just you can see some pulsations going on there. The second feature that you need to know about is your baby's soft skin has a special covering on it known as the Vernix, and the Vernix is a natural moisturizer. It is creamy. It can look icky and yucky when your baby comes out, but it's best to leave it on as long as possible. The practice before was, once your baby is out, your baby is cleaned and shiny, and all of that lovely Vernix is cleaned off. But recent research has shown that leaving the Vernix on for as long as possible is actually very, very beneficial to your baby's skin, because your baby's skin won't dry out, your baby's skin will be fresh. So what you want to do within those first few weeks is just gently clean your baby. In fact, it's not recommended to bathe your baby during those first few weeks. However, if you want to, that's fine, but it's best to gently clean your baby. Just use a clean towel and wipe your baby down, and your baby is good. The third feature that you need to know about your newborn is their eyes. Now, what do I mean by this? Your baby doesn't really see so clearly in those first few weeks. Yes, they can see black and white, they can see blurry visions, but until usually the second month or sixth week, they begin to see clearly. And that's why when you look down on them around the sixth week, they can smile at you, because they're actually seeing your lovely face. Another thing you need to note about their eyes is that they could have a squint. Sometimes one eye might just decide to go to the left or the right. It's totally normal in newborns, and it usually resolves around the 4th to 5th month. Now, another thing is that your newborn's eyes might be puffy and have some discharge, but it's nothing to worry about. It's normal, because they've gone through your birth canal and a lot of squeezing and compression. What you want to do is just gently clean their eyes with a warm, clean towel, and this will take care of the discharge. Still talking about your baby's eyes, they could have bloodshot eyes because they have gone through a lot of squeezing and pushing, trying to come out into the world. So if you see any of this, don't be worried. But if you are, like I said, don't hesitate to see your healthcare professional, just to be sure that there is nothing else going on. Now let's talk about another interesting feature: bumps and bruises. Now your baby has gone through so much, mamas, and it's normal for them to have some form of head swelling, bruises, and this is usually common if you've had some intervention. By this I mean maybe a vacuum was used or forceps were used to extract your baby from you, or if you had some form of complications. It's totally normal, but for your peace of mind, see your doctor and ask them all the questions that you want, okay? Another interesting feature that newborns come out with is birthmarks, or little spots, and some color patches as well. Your baby could come with what we call stalk bites or salmon patches. They usually are pink in color, and they're usually on the forehead, on their eyelids, or their face, and they actually fade over time. Another common one is strawberry marks. Now these are hemangiomas. A hemangioma is usually a collection of blood. Now it can be raised and red and look angry, but these spots, they are totally normal, and they usually fade after a while. Okay, the sixth newborn feature that you need to know about is spots and rashes. So you might be asking yourself, what are these dots on my baby's body? What are these rashes? What are these things? So it's totally normal for them to have some form of acne, some form of rashes, because they are out in the world. They have left the safety of your tummy and they are in the world. Many newborns actually develop a red blotchy rash or little white bumps that are called milia during the first week, and they are totally harmless and they're going to fade on their own. The seventh newborn feature is your baby could have enlarged genitals. Don't be alarmed about this. It's very, very normal. Their genitals may appear swollen, but it usually goes down within a few weeks. In baby girls, a little bit of discharge or bleeding may also appear. And what causes all of this is your hormones. Your hormones from pregnancy, they are still roaming about in your baby's bodies and they could result in all of these things. The eighth newborn feature you need to know about is jaundice. Now, your baby's skin could get a little yellowish glow. However, it's very common in babies. A few babies would actually need some form of treatment because the levels of the bilirubin is what causes jaundice in babies. Level of bilirubin is really high and they would need treatment. I have a video where I talked about jaundice in full, in detail. So if you're interested in that video, please subscribe and check it out, okay? So let's talk about another feature known as reflexes or natural instincts. Now, every baby is born with survival skills. They are equipped and ready to take on the world after leaving the warmth and embrace of your tummy. So there are different reflexes. This could include the sucking reflex, the rooting reflex, the Moro reflex, or it's also called the startle reflex. It usually occurs when a newborn is startled by a sudden noise or movement. So what happens is your baby throws their arms and their legs and then they come back again. So it's like open and close. A very cute and lovely reflex I'm sure most mamas would love is the grasping reflex. So this occurs when you put your finger in your baby's hand and they just clasp their fingers around yours. It's so lovely. So aside from these four reflexes, there are other reflexes as well, but we'll not be diving into them in this video. Moving on to the 10th newborn feature you need to know about: cradle caps. Now, what are cradle caps? Cradle caps are flaky, greasy spots on your baby's scalp. They're usually difficult to take off, but the best way to take them off is by using a soft brush and shampoo. Just gently keep trying to brush them off and wash them off, and over time they would go. Okay, so mamas, there you have it. Those are some newborn features that you can expect to see in your babies. They are totally normal. However, if you have any concerns, please do not hesitate to consult your healthcare professional. Thank you so much for watching. You'll be seeing more of me in my next videos. Until then, stay positive, stay winning, and stay happy, mamas. Bye.